So thankful to have all of you with us today. We will go ahead and get started. This is the Tobacco Free Tuesdays webinar, the May webinar. And I do have to say we are having a milestone day today because we started the Tobacco Free Tuesday webinar 1 year ago in May. It was our kind of response to the pandemic. We spent a year without doing anything with our partners as far as communication. So we started last May and really having these webinars and they've been so successful in getting our communities together, really finding out what's going on in our communities about tobacco control and how we can all partner together for that. So I do want to just kind of briefly introduce our tobacco control team. We have 5 regional coordinators throughout Virginia. We have Nicole in the Eastern region. I'm in the Southwest region. We have Tiffany in the Northwest region. Sarah is in the Central region and Carrie is in the Northern region. So please, I think I say this every time, contact one of us and invite us to your coalition meeting, invite us to come and talk to you more about what we do as a tobacco control program in Virginia. As I mentioned at the beginning of it, we are having Dr. Sunny Shin here today. He is an associate professor at VCU, and he really will discuss his research on preventing tobacco use among youth exposed to adverse childhood experiences. And it's a topic that I am really interested in. I heard about it at one of my coalition meetings about 4 or 5 years ago, and the impact that just knowing about the adverse childhood experiences can have on how we react to, our partners and our communities and some of the risky behaviors that they have and how we respond to it. I think it's very impactful with how we reach out to the community. So excited to have Dr. Shin with us. We will be monitoring both the chat box and the Q&A box. Nicole does a fabulous job with that. So please add any questions that you have in the Q&A box and we will get to those at the end. As I said, this has been 1 full year of the webinars and I can't say enough, the team that you are seeing right now, the regional coordinator, they do an amazing job and they're the reason that we do this every month. They just jump in. One of them will take this month and that month and whatever responsibilities are needed. So thank you for being the best team out there. And if you have been with us each month, and I hope you have for the last 12 months, you know that we start with a what's the T question. And this is just so we kind of see what you already know about the topic. So Sarah has put up the what's the T question. How knowledgeable are you about the adverse childhood experiences study? You've never heard of it. This will be your first opportunity. You know a little, you're somewhat knowledgeable, you're very knowledgeable, or you're an expert at it. So take a couple seconds and let us know what you know about ACEs. Okay, just a couple more seconds. And Sarah will show. Okay, so we have 56% very knowledgeable. And about 12% that they're going to be learning a lot today. So that's wonderful. And that 3% is expert. That's wonderful. Great news. Because again, as I mentioned, I think this can be so impactful with how we reach out to those audiences and how we realize that some of these risky behaviors are coming from those traumatic childhood experiences out there. So thank you very much for answering that what's the T question. And now I have the pleasure of introducing Dr. Sunny Shin. As I mentioned, he's an associate professor in the VCU School of Social Work and School of Medicine, Department of Psychiatry. He is also the director of the Innovation in the Child and Family Wellness Research Group and the director of the Rise Above program, a trauma-informed social and emotional learning and substance abuse prevention program. He has 25 years experience in early intervention and prevention of childhood trauma, as well as drug prevention among trauma-exposed youth. Dr. Shin's research currently focuses on childhood traumatic experiences and addiction. Dr. Shin, thank you so much for joining us today. We look forward to hearing your presentation, and I am going to turn it over to you now to share your screen.
Thank you, Gina. I appreciate it. Hopefully everyone can see my screen.
Yes, we can.
Wonderful. Okay. So thank you for those nice words. My name is Sunny Shin. I'm from BCU. I'm directing the Innovative Wellness Research Group at BCU. It's really nice to have that what's the T question. In that way, I can see more than half are familiar with the ACEs. So I'll probably skip some of the slides, and then I'll be probably focusing on more like in-depth information. So it has been more than 2 years. We are in this COVID pandemic. It's almost, impossible not to talk about COVID pandemic when we talk about tobacco use. So I want to share with you some of the findings that we have in last, 2 years with the COVID-19 and tobacco use. Lots of studies have been published and being published. I simply want to point out like 3 very interesting findings that I see. Number one is that being a current or former cigarette smoker increases the risk for severe illness from COVID-19. So I believe that there's a mixed result in terms of whether smoking itself increase your chance of getting the COVID-19 virus. There's a mixed results, but being a current and former smoker, the risk for developing severe illness from the virus is very high. Second thing that I found very interesting is that there are more current smokers saying that since the pandemic, they have increased their smoking behavior, right? And then people are reporting there's many factors that lead to those increased smoking behavior. You can definitely think about the policy impact. Many of those like lockdown measures, you gotta stay at home, business closed, ban on any gathering. That also has to do with product availability. And people think that, oh, if I go to convenience store, gas station, am I exposing myself to the pandemic? I mean, the COVID-19 virus. And as you can imagine, I have like 3 children, 2 of them in college. They all kinds of get sent back to home. And we had 5 people in a house all together. That changed a lot in terms of the family dynamic. And of course, I have the youngest who was at that time studying high school, and his freshman year entirely Zoom-based. So, and at the same time, one topic that I want to talk about today is that the emotional distress, irregular routines, financial stress, and all those like health concerns becomes a stress. So this is the part from a qualitative study. This is the female, 29 years old, married, and this person saying that I just pile on stress from every direction. I got the normal kind of household stress, then taking away all the time I had outside the house just to reset a little bit. It just kind of keeps the baseline pretty high. I know it probably doesn't make a lot of sense, but I stress because I know that it would make the situation worse if I were to get sick. And then I get stressed over that. That's more stress, and then I smoke more. So very typical response, more stress coming from COVID-19. So some people saying that life isn't good or bad, but it's just stressful. So when I think about stress, we can think about like 3 different types of stress. One is the positive stress. So I am presenting in front of the 54 people. I don't see your faces at all. I'm just speaking to this like a camera, and still speaking in public can kind of create like a stress. But the fact that I'm sharing my information, my research findings with you, it can be very, rewarding. It can be very, I'm blessed to share my studies with you. So those like a positive stress, not necessarily bad. And also in our life, we have the some of those like unavoidable stress. That's in our family, natural disasters. So some of those like stress that we call the tolerable, as long as you have loved ones surrounding you. If some children experiencing some of this like a tolerable stress, as long as they have their supportive parents and family members and friends, they can overcome, right? The third type of stress, this is the topic of today's presentation. Some people call this one as the toxic stress, and some other people call this one as the child trauma. And today we will be calling this one as the ACEs, adverse childhood experiences. So rather than I talk about these adverse childhood experiences, why don't we watch this like a 3 minutes videos that introduce ACEs, what ACEs does to our body.
What would you do if you knew there was a way to help protect your family from future health problems, such as diabetes, high blood pressure, even alcoholism, drug abuse, and depression? The future sounds so far away, but to your children, every minute in their growing brain counts toward a healthier, more successful life. That's because positive experiences and environments help build stronger foundations for developing healthier brains. And healthier brains lead to greater emotional well-being, greater success in school, and brighter futures. Negative experiences like living in a house with verbal or physical abuse, sick or divorced parents, or emotional neglect create toxic stress that can hinder your child's brain development and lead to those unhealthy outcomes in the future we talked about. We've all heard of stress, but what makes stress toxic? When the weight from all those adverse childhood experiences we mentioned builds up, it can become too much to bear and affect how children look at the world. We call those experiences ACEs for short. Leaves you wondering why you've probably never heard of ACEs before. ACEs are common, but talking about them isn't. In fact, 2 out of 3 patients surveyed have at least one ACE, but they may not know how that ACE score is affecting them or their family. That's because a person with a high ACE score doesn't win. As the number of ACEs increases, so does the risk for negative health outcomes. A score of 5 or more on the ACE survey raises the chance of developing severe health concerns in adulthood to 55%. And those with 6 or more ACEs can die an average of 20 years earlier than those with no ACEs at all. Sounds scary, but the worst part? Parents with high ACE scores are more likely to raise children with high scores too. And it can lead to behavioral issues, school failure, and physical and mental problems. But even if you have a high ACE score, there's good news. Because now you know, and now you can change the direction of your life and help others in your family. The key? Well, as we mentioned earlier, ACEs are common, but talking about them isn't. Changing the conversation can help break the cycle and change lives. To start a new conversation, first take the ACE survey online. It's 10 easy questions that'll let you know if you or your family is at risk. Usually that's a score of 4 or more. Whether you score a 1 or a 10, tell your physician. And remember, a child's brain is always changing and growing, so every positive experience you provide is like another building block on the road to a healthy brain and a healthy future. Funded by a grant from State of Tennessee.
Okay. So I know this is going to happen. Okay, there we go. So whether you call it ACEs, trauma, toxic stress, it sounds like it's pretty much everywhere. In especially, this is what my research assistant did for me. Dr. Shin, whenever I turn on YouTube, TV these days, I see it. Now you teach me what ACEs is. I put them all together. So I came up with the 3 questions that I want you to ask yourself today as you are listening to my talk. One is that so what do we need to know about ACEs and tobacco and nicotine product use? My study is pretty much focusing on child and adolescent population, but I'll share information that is relevant to adults and grown-ups too. Number 2, by listening my talk, you'll think about why this is the perfect time to have broader focus on ACEs to prevent tobacco use. And number 3, I'm going to share some programs and policy actions that we can consider as a priority in our agenda. So I'm going to skip all this, like what I call the ACEs basics. But one thing that I want to point out is that this is the study that published in 1998 that coined the term ACEs. So this study published in 1998 is the one that we all of us talk about the word ACE or ACEs. So as the video says, it's like 10 types of adverse childhood experiences. So this is what we call the original ACEs, but these days I'm personally thinking about how about other potentially traumatic experiences. Something like someone felt discrimination, right? Racism, animal abuse. How about the peer victimization? You're living in foster care, separated by your biological parents. How about those gun violences that our fellow citizens in Buffalo, New York is experiencing right now, community violence? About the Ukraine, exposure to war and collective violences. So I have my own ACEs survey, which is more than 10 types, because I believe the San Diego group, they start with the 10 ACEs in 1998. But if you think about other potentially traumatic experiences in childhood, it can be more than 10 types. But the impact of those 10 ACEs are really, really high. Physical health, mental health, and behavioral health. Many of you are already familiar with it. We will be focusing on smoking and nicotine product use today. So how prevalent ACEs are? So CDC has collected ACEs information since 2009. So this is the map that when you see this like a dark green, those are the counties or states that collected ACE information from their behavioral risk factor surveillance system. I think Virginia joined in 2016, I believe. And then if you look at it, different regions, joined the CDC data collection. By 2020, I believe the 45 states and the District of Columbia is participating in this data collection efforts. This is the information coming from 2014 data. This is the most up-to-date information from CDC. So they put out the 8 different ACE categories. Unfortunately, CDC does not collect information on child neglect. So you don't see that one. But if you look at this like a total, you can see that emotional abuse, about 35% of adults reporting that prior to my 18th birthday, I have experienced emotional abuse. That's 35%. physical abuse about 12%, sexual abuse about 11.6%, household substance use about 28%, parental separation and divorce about 28%. So as you can see, the sample size is very large, above 200,000, and ACEs are very, very prevalent in our neighborhood. The video talked about the multiplying effect of ACEs, 35% reporting that they have experienced more than 2 types of ACEs. There's what we call the dose response relationship. The more ACEs that you experience, the higher risk, either physical, mental, or behavioral health risks. So this is the what we call the population attributable risk, the term that we use in public health, that the if you have like a one, for example, incarceration of adults, how much of that behavior can trace back to one potential risk factor, here, ACEs. The Foundations for Health Degeneration studies reporting that about 61% of adult incarceration can trace back all the way to toxic stress that happened in childhood. Alcoholism about the 65%, and if you look at this study, 31% of current smoking can trace back to ACEs that happened in your childhood. So what is the lifetime cost of ACEs? It's very high. This is the study from the Alaska Mental Health Board in 2018. So I'm going to use the this one. 32% of Alaskan smokers likely smoke because of ACEs. If you calculate that one in money, each year, 37,000 Alaskans with ACEs smoke at an estimated cost of $190 million. So make the case extreme. If you can prevent all the ACEs in Alaska, you can save $190 million that is coming from smoking. Smoking itself, not other behavioral outcomes. So couple slides that I have. If you look at the ACEs, so what is those chances that people either start smoking, regular smoking, nicotine dependence? What's the relationship? So this one is coming from the state of Iowa data. So they asked them, are you currently smoking cigarettes? So if you have the no ACE exposure, your smoking rate is 10.7. 1 ACE, 16, 2 ACEs, 20.7. If you have 4 or more ACEs, your current smoking rate is 35.4%. So that's how we rate it. So another study in 1999, this is coming from that original ACE study. They look at the relationship between ACE and the early onset of smoking cigarette. So I want you to pay attention to this orange circle where, compared to those people who have no ACE, if you have 1 ACE, your chance of, or odds of starting to smoke by age 14 increased by 1.6 times. It's not percentages, it's times. If you have 2 ACEs, your chance of early onset of smoking increased 2.2 times. 5 or more ACEs, your chance of smoking by age 14 increased 5.4 times. If you are familiar with the epidemiological studies, public health studies, medical science, the odds ratio of 5.4 is very, very high. This is the coming from my own study in Richmond area. I look at the whether ACE is related to the e-cigarette or vaping behavior. I only look at those like 5 ACEs, which is the child abuse and neglect. And we ask that have you ever used the e-cigarette before? The population here is the young adult from 18 to 25 in Greater Richmond area. Their response that yes, I have experienced e-cigarette use or vaping increased when you have exposure to child maltreatment prior to your 18th birthday. Okay. I know our topic is the tobacco and nicotine product, but I want to show that the same trend being reported early onset of drinking, binge drinking from age 12 to 32. So if you look at the bottom line, that's the no child maltreatment. Top one, those people with ACEs. Youth prescription drug use, the odd ratio increased 1.62 times higher compared to no ACEs. So you name it. If you look at the nicotine use, tobacco use, even e-cigarette use, even though it's like emerging, it's very interesting that many addiction problems, ACEs is the one of the biggest factors. So in this video, you will see all those pioneers who published at the 1998 ACE study, and they will talk about their own findings.
Rob and Vince then began a collaboration that's ultimately become one of the foremost epidemiologic studies of the long-term health impacts of child abuse and neglect.
I think the most important thing that contributes to the creation of the ACE study is simply the powerful nature of when people tell you the truth about their lives and you listen, you understand their life course.
It's made me realize how much of what we see in adult medicine is the result of what was present but not seen in pediatrics.
ACE has changed the landscape, and I want to talk a little bit about how and why they changed the landscape and how we can take what we've learned from the ACEs.
It's just not a social worker's problem. It's just not a psychologist's problem. It's not a pediatrician's problem. It's not a juvenile court judge's problem. It's everybody's.
It changed the landscape because of the pervasiveness of the ACEs, the huge number of public health problems, expensive public health problems, depression, substance abuse, sexually transmitted diseases, cancer, heart disease, chronic lung disease, diabetes.
As the ACE score goes up, the likelihood of chronic, self-acknowledged chronic depression goes up, so that at ACE score 4 or higher, you're bumping a prevalence of 60%, 60% in women and about 35% in men.
This is the percentage of people that ever smoked cigarettes, and here's the percentage of current smokers. We could switch the titles on these slides now. You wouldn't know which was from the Kaiser Health Plan and which was a general population sample in Washington.
So how do those people, without the conventional risk factors, end up with coronary disease? We have used this over an 8-year period with 440,000 adult patients.
I believe that this is the most important thing you can ever do, which is begin to deal with this intergenerational transmission of adversity that causes so many problems in our society.
All right. So, this is my kind of the favorite line graph. This is by the Ante Dubé, good friend of mine. She's now faculty member at the Georgia State University, but she was the program officer at CDC, and she participated in the original ACE study. So believe it or not, CDC has been collected data, epidemiological data since 1900. So the title of this slide is the persistent negative effects of ACEs on health throughout the 20th century. So the way that you read this table is very simple. We're talking about birth cohort. So if you look at the bottom line, green one, that's the birth cohort who born in between 1900 and 1931. I'm not sure whether we have any participant born in this period, but the next one, gray one, 30 to 46, blue one, 47 and 61, and then the red one is the cohort 62 and 79. I am this red cohort. And then we have this like ever smoked, alcoholism, depression, and suicide attempts. So if you see any of these lines touch the zero, the bottom line, that means there's a no relationship between ACEs and each health outcomes, okay? So some people say that, oh, what does that mean that the none of this one ever smoked touch zero? That means that no matter which birth cohort you belong to, there's a positive relationship between ACEs and ever smoked, ACEs and alcoholism, ACEs and depression, ACEs and suicide attempts. So think about this. Good example is the alcoholism. I am using lots of example in my class whenever I talk about, alcoholism, substance abuse prevention, and I use like a lots of drama shows. But if you think about 1935, 1940, we have like a Great Depression and then Prohibition where the alcohol was not available, illegal. We still have the links between ACEs and alcoholism. Think about what happened in 1960s, Vietnam Wars, and all those different things. So what this slide is telling us is that the impact of ACEs, it's way beyond what cultural factors, policy factors, social factors, or even family factors can do. So that is why when you think about, so why then those victims of ACEs have increased likelihood of tobacco use, nicotine product use? It does something to our neurocognitive biological development. And as a fact, I'm going to share one slide how ACEs influence brain development. It impairs our social development, emotional development, cognitive development. And as a result, you adopt high-risk behaviors. I have my own study about the ACEs and obesity. Lots of a strong influence from ACEs to the the problematic eating behavior. And then it ends up with the disease, disability, and social problems. So I'm going to share with you just the one slide about the brain images. This is not even recent studies. This is the functional MRI image for a 4-year-old boy. So left one is the healthy brain. The right one is the boy who have been exposed to the severe child abuse and neglect. So this is the what we call the neural activation image, where you put the child into the MRI room and they play with the small video, and then your brain naturally activated. If you look at this all this red, The red is the most active, black is least active. And you see the clear differences between this healthy brain and toxic brain. I can go on and on in a way that when you look at the gray matter volumes in your brain, the dense greater gray matter volume, the better communication in between different regions of brain. You will see that the ACE victims, their gray matter volume is much less dense compared to non-ACE patients. So one thing that I want to share is that so what can we do today, right? And one thing that I want to share is that what is the trauma-informed tobacco prevention program look like? And we don't have like that much time. I only have 11 minutes to go, but I want to super emphasize the primary prevention of ACEs, right? If we can prevent ACEs even happening, we don't have to talk about trauma-informed tobacco prevention. So in that sense, one thing that I want to share is that that has been like as of the lifetime challenges. So before I joined VCU, I was faculty member at the Boston University Medical Center for 11 years as a faculty. I worked with the many low-income areas, Dorchester, Rochester's, East End in the Boston, low-income area in the Boston Public School, and we have provided many different programs in order to prevent tobacco use. Some of them has been working, but not as much as I expected. So this is the program. Since I joined VCU in 2013, we have developed this program. So this is not necessarily focusing on trauma victims. This is the social emotional learning program for everyone. But this is the very much trauma-informed. I'll show you why it is trauma-informed. So very briefly, maybe some of you have participated in our focus group. We have done thousands of the focus group with the service providers like you, school people, as well as we did lots of the focus group with the parent caregivers, family members, community leaders, as well as middle school and high school students. And the program that we have developed, this is for the fourth graders all the way to probably 11th graders. This is the small group program. 6 to 8 youth is like a recommended per group, and we have like 20 sessions. And each session is about 50 minutes. The program is called the Rise Above, and we named the subtitle Building Life Skills to Overcome and Thrive. So our logic model to prevent youth tobacco use and other substance use is like this. The program has psychoeducational component, CBT component. We emphasize lots of skill building, and we do lots of the mindfulness-based components. And then we have the trauma-informed component. Yes, we do teach them how their brain works when they are exposed to trauma. So I'm going to show you, after I stop sharing my screen, one page that we use when we talk about stress and brain. Our program comes in 4 different units, and you're looking at the 4 different student journals. One unit, we title it as a Living a Drug-Free Life, Mastering Your Thoughts and Feelings, Boosting Your Greatest Inner Strengths, and Building Healthy Relationships. So this is what we share with them when we talk about the tobacco and nicotine products. So we talk about potential influence of your body and mind. And then we talk about the peer pressure and potential family pressure, And we talk about the media pressure, including social media pressure to use tobacco and nicotine products. So of course, we provide the lots of the psychoeducation, normative education about the nicotine, harmful nature of nicotine and everything. And we share the risk and protective factors for the nicotine and tobacco product use. And then we do lots of the skill building, focusing on awareness, coping strategy, and resistance skills. So this is the prevention program for young people. So we make this one very student-centered. It's very interactive, game-based, lots of the videos, sharing, and stories. And all these stories coming from the teen focus group themselves. We ask them, what is your life about when people offer you vaping products, cigarettes, beers, and based on those real life stories, we put them into stories. So this is a page where we talk about, yes, we do talk about the brain and then medical science 101 with the how trauma and stress influence your brain. So we do talk about those HPA axis. Believe or not, we have done this one with the third and fourth graders. They totally understand it. And we teach them lots of the meditation skills, relaxation skills, muscle relaxation skills that they can practice and use at home. So this program is being offered in person as well as virtually. We are working with the Henrico Prevention Department at this time. We are in communication with the 6 schools in Chesterfield County. And we are actively recruiting agencies and schools for the summer, as well as upcoming academic years. And thank you, Nicole, for putting our program website, riseabovenow.org, into the chat window. I'll be more than happy to share more information with you if you're looking for any social emotional learning program. Again, it's not for the ACE victims only. It's for children and adolescents in general. And this program is also available virtually. So we have worked with the Page County CSB. We have worked with the Region 10 CSB. We have talked to many CSBs previously. Okay, another thing. So our program is a teen-based program. When we did our focus group with the parent and caregivers, one mom was saying that, okay, Dr. Shin, I have 2 jobs, sometimes 3 jobs. When school sends me a newsletter, which is the 3 and 5 pages, I don't honestly read it, but I do care about what my child is learning from each program. So we came up with this like a newsletter, kind of the psychoeducation newsletter for parents, the helping parents rise above. And we have for each lesson, we have this 2-pager infographic. Their child will bring this one home. They will see what their child learned, and we even put a small activity that they can do with their child if they want to at home. So the good news is that this program is 100% free to community participating agencies, because we are getting support from the Virginia Foundation for Healthy Use, as well as the NIDA. We are very grateful that we have those resources. So we even provide the facilitators. They are all master level program facilitators. They are all certified in the TFCBT and the multicultural training. And we do provide student journals, class materials, and our facilitators. And if your agency kinds of thinking that, oh, we like this one, can you train our counselors, staff? Yes, we do have those training the trainer program too. So final insights. Let's see, I have 2 minutes. ACEs are very common. And children in our society often encounter multiple ACEs. As I shared, about 35% experience more than 2 types of ACEs. ACEs increase an individual's risk for tobacco use. It's very critical to include ACEs among the primary risk factors for tobacco use. When you think about any tobacco use plan, prevention, or the cessation programs. And development and dissemination of trauma-informed prevention program are very, very necessary, whether you are talking about tobacco products, nicotine products, or any other illegal or illicit substances. My funders, my collaborators, and my research team, and I thank you for your attention today.
Hi, this is Nicole Mayen. I'm going to kind of move it over to our question answer portion, but thank you, Dr. Shin, for all your information. And I like the videos. I think everyone's been kind of quiet today, but I think because we're all trying to absorb that information, really take it in, you know, from our initial what's the T question, you can kind of see how some people didn't know anything and there were some experts. So I think this was a great webinar to kind of get everyone informed about it and also your program. And I did enter the link for Rise Above in the chat as well, so people can definitely look more into that and contact you for more information as well. So we have a few minutes for some questions, and I know we had some from registration, so I think I'll pick one to start. You know, you talked about ACEs and the link with prevention. So do you have any policy strategies for addressing tobacco prevention with youth who have experienced ACEs already?
Right. So, you know, policy strategy wise, the people have to think about in a way that the how, you know, wide. So one example that I want to share is that the state of California, they have the state surgeon general, and then she initiated the couple policy initiatives where it's not necessarily about the treatment itself, but it's like a more training primary service providers, including the family doctors. So very interesting thing is that the our what is the T question? We have about 56 people know about ACEs. I go to the VCU Health, do the same survey with the pediatricians and primary doctors, which I did about 3 years ago. The rate is even lower than what we had this morning. So one suggestion that we have is that those primary doctors and family doctors are the one, and pediatricians will be the one that will face pregnant mothers, children for child visit as well as the sick child visit. I think it's very important to think about how to train our service providers. And number two, whether we can make those training cross-sectional and cross-disciplinary. Because very interesting that we talk about ACEs more in the field of, for example, social work compared to medical schools. So one thing, policy strategy, I would suggest to the state of Virginia, for example, is that develop a training program with CSD, multidisciplinary, that is heavily focusing on prevalence of ACEs, what is the trauma-informed care, what we can do for all the Virginia residents when it comes to ACEs and tobacco use.
Thank you for that. Yes, I definitely agree. I know the CSBs around, they do offer training on ACEs, and that's free as well. I think we'll be including some more information about those trainings in our follow-up email. And we do have some questions in the chat. In regards to the Rise Above program, how many weeks is that? And I guess how many times per week?
Good question. So again, I love focus groups because that's the place that I hear about what's really happening in the community. I was told that hey, Dr. Shin, do not make this one as a cookie cutter. Make it as flexible as possible. And this person telling me using the Lego blocks, put this one as like a Lego block, little pieces. So we simply saying that as long as we can do 20 sessions, 15 minutes per each session, we're okay. So we have done this one with the Region 10 CSP twice per week, Tuesday and Thursday. So for that program, it has been 10 weeks. Henrico County, we're doing this one once a week. So for that one, 20 weeks. Possibly we can do like a maximum 3 times per week. We were approached by the other schools saying that, hey, we have this like a monthly school assembly. Can you do this one monthly? We said no, because I don't think the students' memory and attention can last like a month. But I'll say that the maximum 3 times per week. And if you do this one like a 3 times per week, you can complete the entire 20 lessons within 7 weeks.
Great. And then a follow-up question, can the Rise Above intervention be applied in a shorter modified version? So maybe like during school lunch, like 20 to 30 minutes?
So we have heard about the lots of the questions and recommendation like that. We also heard that the Virginia is using lots of the day treatment model, and we don't have like that many curriculum for day treat model. Can we use this one for day treat model? And we say no, because this is the prevention program. Possibly in the future, the reason that we put them into the 4 units, 20 session is that without giving them a basic foundation of cognitive understanding, emotional understanding, sharing, tobacco use, peer pressure, resistance skills. One thing that I found in my, especially Boston experience, is that those skills would not stick. They will fade away very easily. That is why we are intentionally develop this program, bring tons of emphasis in terms of their understanding of their coping strategy, response, and everything. So we can try, but the current curriculum is the 50 minutes per session.
Thank you so much. We have some more questions in the chat, but we'll follow up with these two after. I think we only have 4 more minutes, so I'll pass this on to Gina to kind of close us up for the day.
Thank you, Nicole, and thank you, Dr. Shin. Your presentation was it was fascinating. I enjoyed the entire presentation. Couple things just because I really want to go back. I want to look at your website, and I encourage all the participants to do that as well. 1998, I think, is when you said it first started coming out. So it's almost 25 years, and now we're really just getting a chance to really talk through it in our communities. So I think this is definitely will be impactful and should kind of drive the way we reach out to our communities, our individuals. One of the stories in the video said, just listening to the powerful stories of people's lives can make that impact with how we treat them and how we really put policies in place to make that impact in the communities. That was amazing. Did you also, just talking to the audience here, see the pictures of the brain development of the 4-year-old little boy from a healthy brain and then a toxic brain? It's just very fascinating. And I think we really need to just take some time and review your presentation and really talk through in each of our local communities. And I do know this conversation is being had. Nicole, I think, mentioned the community service boards and the trainings they provide with ACEs. If you know or have a relationship with your community service board, I encourage you to meet with them to get this information. If you do not, please reach out to us. And I think Carrie's going to put this in the follow-up email where we can direct you to the person you need to talk to about this. But I think the conversation has started over the past few years, and I think it's something we really need to delve more into as we go through this. So Dr. Shin, thank you so much for really enlightening all of us with the presentation, with really how ACEs impacts not only tobacco use, but so many of those risky behaviors out there today. So thank you. We have one last return to the T question. So Sarah, if you could put that up for everyone. And it is preventing ACEs could reduce the number of US adults who, and check all those that you think apply, have depression, currently smoke, have COPD, have asthma, or engage in heavy drinking. And I think Dr. Shin covered this one, so I hope we get these, we do really well on this test. Okay, and now we will see the results. Yes, definitely. I mean, it really impacts them all. They found preventing ACEs could significantly reduce the number of people with certain chronic conditions, as well as the number who engage in the risky behaviors. And I'm gonna pull a couple of those. Preventing ACEs could reduce the number of US adults who have depression by 44%. Currently smoke, which is our field, by 33%. So such an important topic that we're discussing today. I think Nicole put the Rise Above website in there, so please look through Dr. Shin's research and find out more information about that. Email, I think there have been some chat conversation going on about the community service boards in your area. We will follow up with that in an email as well, so that you can really get connected with your local Virginia Community Service Board and start this very important work. I also noticed in your presentation, Dr. Shin, if you would like to take the survey, and I wrote that down, baptistonline.org/UPP. Am I correct on that, Dr. Shin?
Oh, you know what? That's one of the video, but the let's see, it's pretty much everywhere if you Google it. But here's one from NPR. Even NPR is having this one, so let me put that one into the chat window here, as well as what I'm going to do is that I'll put the program brochure for the program into the chat window too now, so you can just simply download it.
Great, thank you so much. I appreciate that, because I think that would be very beneficial to all of us. So the next webinar, please invite your friends, invite your partners, invite anyone you think has a role with tobacco use control in your community. And I think that can very much include all of us and anyone you work with. So our next webinar is Tuesday, June the 21st from 10 until 11. We're currently finalizing our speaker, so we will send more information about that soon to you so you can register. Thank you again for joining us today. Thank you, Dr. Shin, and we will look for you in June. Enjoy your week.